Welcome back to Cheddar, everyone. On Tuesday, the U.S. Food and Drug Administration, known in your hood as FDA, announced the authorization of a rapid coronavirus test that doesn't require a prescription and can be done entirely from home. This comes as American Airlines already rolled out its own at-home test. The airline making tests available for purchase last Wednesday for travel starting this past Saturday with at-home testing partner LetsGetChecked. Joining us now is Kim Cisek, who is the Managing Director of Customer Experience Innovation at American Airlines. Great to have you here with us today, and thanks for taking the time to discuss. We got to know, how does American Airlines verify the testing to ensure the safety of both the flyer taking the test and the other flyers who will also be traveling?
Hi, Brad. Thank you so much for having me on today. I'm excited to join you here from the Dallas-Fort Worth area and excited to talk about our Let's Get Checked at-home testing program. So we did launch this actually back in October with our Hawaii market and have since been expanding to several Latin American and Caribbean countries. And as you mentioned, we now have expanded to allow for any customer traveling on American Airlines to a domestic in the United States location that has travel requirements. They can use our Let's Get Checked at-home testing product. And the way that it works is customers can go through our AA.com website or a link from communication we've sent, and they can actually order their testing kit. And it's a medically observed test in most cases, as most countries require this. And this allows us to ensure that the customer is taking their test. It's done with a medical professional through Let's Get Checked. And they submit their testing results back and are receiving their results back on average in 48 hours or less. And we then know that the customers have taken their test and they receive their test results back. So when they're traveling, they are confident that they have what they need to either travel to a specific country or a state within, or a domestic state.
Certainly. Okay, so correct me if I'm wrong, $129, is it necessary, required for all travelers, or only specific destinations or locations right now?
So right now it's actually just specific destinations. There's a lot of countries that require certain tests. And what's great about Let's Get Checked is it is the molecular test. It is a RT-PCR test, which is known as the gold standard. And many countries require this type of test. In addition, we've seen some states require this as well, including Hawaii. And some additional states have testing requirements, but it may not be a PCR, but when you're using Let's Get Checked that you are using a PCR test. And so that's the great thing, is that you are confident in the type of test results that you're taking. So for right now, we do offer it where it is required.
Got it. And so just to understand this further, because it is a health check essentially before you are going on a flight, so should this fall under any type of healthcare coverage in the future? May it fall under any healthcare coverage where that $129 fee perhaps can be covered by somebody's insurance even?
Yes, the great thing is, as customers sign up for their test through Let's Get Checked, if they have insurance or with their certain insurance providers, may actually cover the $129. We also have some additional testing options for customers traveling on American Airlines that can also use their insurance for the $129. That is for the medically observed option that we have through Let's Get Checked. There is a lower cost option should the country you're traveling to not require something medically observed.
Understood. And so just for some data points, in terms of the number of travelers that have either already requested to this point or you anticipate accepting the test option, ballpark, what are we looking at right now?
So our Let's Get Checked option is the option where we're seeing the highest number of our customers utilizing this particular option we have. We have our at-home testing with Let's Get Checked. We have some community partnerships as well as in-airport testing. And what we've seen is customers are really liking having the at-home test because you're ordering it at home, you're receiving that, in your home, taking the test with a medical provider and shipping that back. And so you have your test results in hand prior to traveling. So that's actually where we're seeing the highest amount of volume. And we've had in the thousands of customers using the Let's Get Checked option, and they have been fantastic partners. And we've gotten incredible feedback about the process, how easy it is to understand what to do, and getting your results back in time and being confident that you're ready to travel.
Kim, I would love to continue this conversation at a later date. That's all we have time for today. Kim Cisek, though, who is the Managing Director of Customer Experience Innovation at American Airlines, kind enough to take the time here with us today.